So, welcome. Today, we're going to talk about the essential steps to starting your Medicare coverage if you're turning 65 and you do not have employer coverage. So, you don't have employer insurance yourself and you don't have it through a spouse. Now, I know it's confusing, but turning 65 is a really big milestone and it's just that time. It's time to think about Medicare. I know it's overwhelming, but we're going to break it down. Let me start out by saying happy birthday. So, first off, you're going to want to enroll in Medicare Parts A and Part B. Yep, we're going to jump into the letters right away. Part A of Medicare covers hospital stays. I always like to call this the inpatient part of Medicare. Hospital stays when you're inpatient in a skilled nursing facility, when you are in hospice, or some home health care. Now, Part B, you can think about this as outpatient. This part of Medicare takes care of doctor's appointments, outpatient surgeries like day surgeries, lab tests, x-rays, and preventative exams. Oops, get on the right page here. How do you enroll in Medicare? We enroll in Medicare through the Social Security Department. So you can either go to ssa.gov, which is Social Security Administration's website. You can call 1-800-772-1213. If you call to enroll in Medicare on the phone, they're going to set up an appointment with you and then call you back, just so you know. Or you can just stop into your local Social Security office. Oftentimes they want to make an appointment with you as well, but I have heard of people who are just able to walk in and get an appointment and sit down and have somebody help them enroll in Medicare. One thing I do want to point out here is if you are already receiving Social Security benefits, so you're getting a check monthly from Social Security is going to automatically enroll you in Medicare Part A and Part B 3 months before you turn 65. So you're just going to watch out for that card to come in the mail and you're going to get enrolled right away. You don't have to do any of this enrolling yourself. Next question, when do you enroll in Medicare? Well, Medicare has something called the initial enrollment period. It is exactly what it says. It's the first time you can enroll in Medicare. It's your initial enrollment period. This enrollment period lasts for 7 months. It is the 3 months before your 65th birthday month. Include your 65th birthday month, and then the 3 months after your birthday month. So the first time you could enroll in Medicare is going to be 3 months before your birthday month. On the first of that month, you can call Social Security. You can go to ssa.gov and go through the process of enrolling in Medicare Part A and Part B. When you do this in the 3 months before your birthday month, Medicare is going to start on the first of your birthday month. If you enroll in Medicare in your birthday month, Medicare will start the first of the next month, and then it's just going to do the next month enrollment period. So if you enroll in any of these months after your birthday month, Medicare will start the first of the next month. It's very important that you do not miss this enrollment period because there could be penalties that you face later on if you do. Now, Medicare has a lot of out-of-pocket costs. So Part A and Part B, it's good insurance. It takes care of you in the hospital and doctor's appointments, preventative medicine, but there are a lot of costs associated with what you have to pay with this. And that's why people will choose either a Medigap or a Medicare Advantage plan to go along with their Medicare Part A and Part B. So Medigap, it fills in the gap. It's also known as a supplement plan. So what this means is with Medicare Part A, you have a deductible when you're admitted to the hospital. Medicare Part B, you actually have a co-insurance, which means that for every doctor's appointment, surgery, all the bills that you have as an outpatient, Medicare pays 80%, but you pay 20%. Now, the deductible when you go to the hospital and the 20% that you have to pay for doctor's bills, those are called the gaps. A supplement plan or a Medigap plan helps you pay for those. That is one option that you have with Medicare. The other option that you have with Medicare is to get a Medicare Advantage plan. What a Medicare Advantage plan does is it bundles everything that Part A and Part B does It also includes prescription drug coverage and oftentimes other benefits, such as dental and vision, that Medicare doesn't cover. They bundle this all into one little package of insurance, and then you can roll into that Medicare Advantage plan. They're offered from insurance companies, but they are approved by the government. These are the two options that you have, and I suggest that if you are at the stage where you are deciding what to go with, that you spend quite a bit of time learning about these things. I have some other videos on this, finding out which one is really what you should do, because they're different, they cover you differently, and you really need to get into the nitty-gritty of this to really understand what you should do. I mentioned prescription drug coverage. Part A and Part B of Medicare do not cover prescriptions. So if you have Part A and Part B, you need to get prescription drug coverage. If you choose the Advantage plan option, it will come bundled with prescription drug coverage and you're taken care of. But if you choose the Medigap option, you'll have to pick up another plan, the prescription drug plan. Don't forget to do this, because there are also fees if you do not enroll on time in a prescription drug plan. It is important to act now. Enrolling on time will help you avoid penalties. It's going to ensure that you have coverage when you need it. So take action now. It's going to save you a lot of stress down the road. If you want more details, you can always go to Medicare.gov. That is the resource for everything Medicare from the government. Medicare.gov releases a publication every year. It comes out usually, I believe, in October for the next year. So right now I'm recording this in November 2024. The Medicare and You Handbook for 2025 has been released. So you can go to Medicare.gov, find the publications section, and download the Medicare and You book. This booklet is a handbook, I guess is what it's called, is very, very thorough. It's written very, very well. You can find a lot of answers to your questions from the Medicare and You book. Enrolling in Medicare is manageable. I hope these steps have made it a little bit easier for you to get started. Thanks for watching. Take action today for a healthier tomorrow. And as always, contact me for any other questions.